Dr. Andy Rosenbarger. I'm talking to you today about alternating current stimulation and how it could benefit retinal conditions like retinitis pigmentosa, rod cone dystrophy, cone rod dystrophy, and Usher syndrome. Now, we know that these conditions are most likely, if you followed my material, autoimmune. Okay, these are most cases autoimmune retinal conditions that the immune system is attacking the retina, and there are most likely antibodies similar to like arthritis or these types of situations, or people who maybe have eczema, or psoriasis. These types of conditions are also autoimmune. So that's not so important. The cause isn't as important when we're talking about the ACS therapy. When we talk about using supplements in diet, nutrition, and lifestyle, that's where it becomes pretty important. The alternating current stimulation therapy is more designed to be a mechanical stimulation, which has a specific effect that we're going to talk about in a little while. But first, let's do a little bit review about these conditions. Again, specifically retinitis pigmentosa, rod cone dystrophy, cone rod dystrophy, and Usher syndrome. So all of these conditions have in common that you have night blindness. And again, let me back up for a minute. So before we get into the characteristics of these conditions, we want to talk about the genetics, right? So it's been said that these cases are genetics, RP, retinitis pigmentosa, Usher syndrome, that these are genetic progressive vision loss conditions. So I don't agree. I agree with that to a certain extent, and in some instances I don't. Why? Because there are some individuals who visited our clinic, quite a few actually, who there's no family history. And when they do gene testing, there's no gene that comes up. So I would say about half of my patients are first generation RPers or those with Ushers, and there's no family history. And if they can't find a gene sequence that specifically shows that this is a genetic condition, then it's likely and possible that there's no genetic component. So we know that some cases, without question, there is definitely a genetic component, but not all. So let's move on to the characteristics or the symptoms of these conditions: RP, Ushers, and rod cone dystrophy. So we know that we're dealing with initially night vision, right? Problems with night vision, problems with peripheral vision as the condition develops. We start to move towards tunnel vision. Initially, there is, in earlier stages, there's good central vision, there's good far peripheral vision, but it's the mid visual fields that start to break down. They start to move back, and we start to lose far peripheral vision, and then we're left with just central vision that starts to close in over time, and it's more of like a tunnel vision that our peers in more advanced stages deal with. There's also problems with dark adaptation. So that means is when individuals with RP, Ushers, and rod cone dystrophy go from outside to inside, it takes their eyes a while to adapt. So where maybe you and I can go in, or people who don't have these rod dystrophy issues, they go from outside to inside in the transition. Our eyes can adapt in seconds, where these folks, it may take them 20, 30 minutes, sometimes even up to an hour in some cases. So that's another thing that we see. You can also have complications that arise with these conditions, things like cystoid macular edema. That's fluid that builds up in the macula as a result of inflammation and lymphatic congestion and other factors as well. Usually oxidative stress can contribute to that as well. You can have things like flashes, right? Like eye flashes. You can have floaters. You can have light sensitivity. You can have early stage cataract development. Sometimes the pigmentation makes its way to the central vision, and it can start to affect the macula. So not only will you have vision issues with cystoid macular edema in terms of your reading and acuity, but if the pigmentation starts working its way into the central vision or the macular area, there can start to become issues with reading and face recognition in your high definition visual acuity. Other issues that show up with RP and Usher syndrome are certain color sequences, difficulty with specifically browns, reds, and greens. Those color schemes are particularly difficult for people with RP and Usher's and rod cone dystrophy. Other very common problems are with contrast because the rod cells, the rod photoreceptors, are responsible for contrast, right? They help with dark light, our grayscales. So contrast can be really difficult, often on gray, hazy days, or there's overcast skies, creates more difficulties for people with RP and Usher's and rod cone dystrophy to function. So we understand that that's it. We also know that there's no conventional biomedical treatment for RP, Usher's, and rod cone dystrophy. Of course, there have been research with stem cells. There's been research with gene therapy. They're not quite there yet. Certainly, biotechnology is coming on strong with some solutions. So right now, it's pretty much low vision, functional medicine, acupuncture, Chinese medicine, even Ayurvedic medicine. This is the best that's available right now for people dealing with these conditions. So one of the things we talk about, of course, is alternating current stimulation. And what is alternating current stimulation? Glad you asked. So the reason that we created alternating current stimulation, I'm going to talk about why I created alternating current stimulation before we get into what it is. So why did we create this alternating current stimulation home unit for people to use? Well, there's a lot of reasons. First and foremost, the last microcurrent devices were developed about 30 or so years ago. So although they were pretty effective, in my experience, my clinical experience, I guess I would see probably about a 50% efficacy in those. So wasn't enough for me to recommend it to all my patients. My clinical marker, what I look for in terms of functionality and results, pretty much, are 70% or more. So for me to recommend any integrative alternative treatment to help with vision, can't do any harm, and it has to have a benefit of 70%. That means 70% of people, 7 out of 10 people who use it, have to show some level of measurable improvement. So that is where we're looking at. We want to show something that had at least a 70% clinical efficacy. And this ACS unit, the research is based on information that we found when we were doing our research with Johns Hopkins and Nova Southeastern, research out of Germany. All right, so there are some German doctors who are working on alternating current stimulation in their clinics in Germany and quite a few other clinics around in Europe. And we had implemented them into our clinic, these modalities prior to COVID, about 2 years prior to COVID. So about 2017, I started using these mostly on children because a lot of kids they're not really tolerant to acupuncture. It's too invasive and too uncomfortable for them. So we're looking for other ways to try to help younger children. And then once COVID hit, we wanted to help people with accessibility and affordability because patients couldn't travel to our clinic. They stopped working. A lot of people lost their jobs. So accessibility and affordability really became a factor for a lot of people. So I wanted to design something that worked, again, had 70% or better success rate, that was safe and effective for people to be able to use at home. So I also wanted this to be able to be used as a standalone therapy, meaning that if you couldn't go get any other treatment, that this would be useful for you to use at home and provide enough results for people who are just doing this ACS therapy at home to see measurable improvement. We also created this to be used as an integrative treatment with other therapies like acupuncture, hyperbaric, laser therapy, supplements, eye exercises, whatever else you're doing to help your vision. So we know it's safe and effective and it's a proven treatment. There is enormous amount of research. If you guys want to do your own research, you can go online, either PubMed or Google Scholar. If you type in alternating current stimulation, ophthalmology, eye diseases, retinal issues, optic nerve issues, you're going to find a lot of research. And again, most of that research is coming out of Europe and specifically Germany. So that's why we created, to really just provide a solution for people who are unable to travel and also where cost was a factor. So let's dive in and talk about a little bit about what alternating current stimulation is. Again, I use the abbreviation ACS for alternating current stimulation. Now, in our studies, we were originally using transorbital stimulation or transcorneal stimulation. And although that was effective, it wasn't super comfortable and it had a couple of issues with it. So we were looking to other modalities that were similar that were getting the same result. And we found the transocular or transorbital stimulation, which is another term for alternating current stimulation. So I'm saying that because if you do some research online for alternating current stimulation and you come up with terms like transocular stimulation or transorbital stimulation, that's pretty much the same thing. So you just want to be clear about that in terms of definitions. What it is, it's an electric frequency specific alternating microcurrent therapy, rather. So it's where tiny electrical microcurrents that are barely perceivable provide electrostimulation to and around the eye through the whole visual system. That means the eye, the retina, the optic nerve, and the brain, the visual cortex, and the prefrontal cortex. All the eye and the parts of the brain that are involved in visual function. So we find it to be extremely effective for all neurovascular ophthalmic conditions. There's some conditions we haven't found it to be super helpful with, but certainly retinitis pigmentosa, ushers, and rod cone dystrophy and cone rod dystrophy. These retinal conditions are responding very, very well to treatment. So how does it work? All right. So the ACS works on the visual system in a lot of ways. There are really two main factors that we're trying to do here with the ACS treatment. The first thing is we're trying to dilate the blood vessels to increase blood flow and get more vital nutrients to the eyes for repair and regeneration. The second thing is the stimulation is waking up the retina, the optic nerve, and the whole visual system. So these dormant cells that are sleeping, we're actually going to wake up. And by increasing blood flow, we're adding oxygen to the eye, which I know I'm getting a little technical with biology here, but we're going to stimulate what's called the mitochondria, which are the energy producing powerhouses of our cells that aid in repair and regeneration through a process called protein synthesis. So that's where repair and regeneration happen. And these mitochondria in the cells, which is part of the cell structure, cannot operate without sufficient oxygen. And we also talked about how, if you followed me before, the retina is the highest oxygen consuming tissue in the whole body. So anything that's going to help with the dilation of blood vessels to increase the oxygen supply to the retina is without question going to be extremely useful in terms of both vision recovery and long-term vision preservation. So again, what we're really talking about here is dilating the blood vessels to bring more oxygen, more glucose, more vital nutrients to the eyes and the brain, which allows the nerves to eat, breathe, metabolize, and regenerate. We're also, again, waking up the dormant cells, the dormant sleeping nerve cells that have gone to sleep. They're not dead. A lot of you go to your eye doctor sometimes to look at these dark areas and they'll say they're dead. They're really not. They're actually dormant. So there is most likely a portion of your vision of the cells that are probably dead or scarred over, and there's probably a portion, an unknown portion, that is dormant. Now, using ACS therapy, we're going to wake up the dormant cells, and after anywhere from 6 to 15 months, whatever we've recovered was obviously dormant. Whatever is still non-functional, we can assume is probably dead scar tissue or fibrosis. So we also know that the ACS works on neuroplasticity. And what that means is it improves the brain's remaining visual capacity by rewiring and refiring the electrical impulses that are transmitted from the retina to the optic nerve to the brain. So we want to really make that signal clean and efficient. All right. And that's what we mean by neuroplasticity. The brain is optimizing the nerve pathways and the tracks by which the nerve signals from the photoreceptors are being processed and transmitted to the brain. We also know that treatment also guides stem cells to the eyes, right? So stem cells is really big these days. And if you're interested, I have my opinions on stem cells. I have a whole video if you guys want to watch that on my YouTube page. It might be of interest. But long and short, I'm of the opinion that most people don't have an insufficiency of stem cells. All right, I don't believe that. I think that if you cut yourself and you can heal, most people have intact immune systems where they also have ample adults have ample stem cells for repair and regeneration, which is what they're used for. Now, the question is, do the stem cells get to the retina because of all the blockages and the congestion and scar tissue due to the blood vessels that are broken down? And or is the environment, because the inflammation, the oxidative stress, and the hypoxia and the acidosis, the sick environment of the eyes, that the stem cells simply just can't grow because the environment is too unhealthy or hostile. It's like trying to plant a garden, like a rose garden, in the middle of winter, right? It's not that the seeds are fine, the grounds are fine. It's just the conditions are not hospitable to that growth and germination. So I believe that's similar what's going on with stem cell. And if you guys want more information or interested in that, you could certainly again watch my video on that. And we know that there are these growth factors that also can migrate to the eyes when we use things like acupuncture and alternating current stimulation to again aid with repair and regeneration. So using these therapies like acupuncture and alternating current stimulation, even hyperbaric therapy, we know that stem cell activity is going to be hyperactivated. And then we use acupuncture, alternating current stimulation to guide those stem cells that come from the bone marrow and your fat cells to the eyes for repair and regeneration. And we're using ACS to also dilate the blood vessels so the transportation of the stem cells to the eyes. And we've actually had patients who've been undergoing stem cell therapy of various sorts, and they're actually using alternating current stimulation along with that to aid in the directing of stem cells to the eyes and the retina to optimize repair. So really cool stuff there. We also know that the alternating current stimulation is going to focus on repairing the vascular system. I always talk about how important blood flow is, and that means we have to have healthy, flexible blood vessels, right, that are unclogged and in integrity. So we want to really have a healthy, strong blood vessel system. The blood vessels that feed the retina are called the choroid. So you may have heard that. There's also your arteries and veins that feed the optic nerve and retina as well. So we also know that there's not really a lot of side effects that come along with alternating current stimulation. I see somebody asked a question about that. And the thing with the side effects is there's not too much, right? We use caution with patients who have seizures or migraines or anything like that, maybe epilepsy. What we've noticed too is when patients put the pads over the eyes, if the band is too tight, or they have dry eyes, or they've had LASIK surgery, they may be blurry for a little while. Maybe it's 10 minutes. And if your eyes are really blurry and you've had LASIK surgery, it can even be up to like 45 minutes. And the reason that is because your lens is like this. And when we put the pads on the eyes, it puts pressure against the cornea and flattens out the convex shape. And it kind of goes like that. And it takes a little while for the shape to return of the cornea. And again, that has a lot to do with hydration and dryness or any scarring going on around the cornea. So that in most cases will recover usually fast if that's something. If that's an issue for you or somebody's dealing with that, what we usually do is we have them just use like a scarf or a handkerchief and use a looser pressure on the pads over the eyes so it's not there. If it's an ongoing issue for people, then we'll instruct you to maybe change the placement of the pads, maybe not directly over the eyes, but we'll look at maybe the temples, the forehead, the occipital area as well. So there's ways to tweak that. But other than that, there's really no side effects and there's no contraindications other than, severe migraines, uncontrolled epilepsy or seizure disorders or something like that. Those are really the things that we're looking at. We've had a couple of cases where people just turned up the stimulation too high, and that affected it obviously caused like a headache because they just were too aggressive with treatment. So the other benefit of alternating current stimulation is there are a lot of acupuncture points around the eyes, and alternating current stimulation will stimulate all these amazing acupuncture points or neurovascular junctions around the eyes that will really help with repair and recovery in terms of getting, in Chinese medicine, we call the qi and the blood to the eyes to help with repair and regeneration, which ultimately is going to promote acceleration of vision recovery and long-term preservation. So as you guys might, I kind of alluded to this. I developed this in 2017. The unit itself, we finalized production in 2019, but because of COVID, it took us about a year and a half longer than we wanted to or expected to have it come and manufactured, be available to us. So it is research based. We talked about that. If you want information or you're interested in finding more about the research on alternating current stimulation, you can look at some of the online studies around that, and you'll certainly find plenty of that. And again, our goal here is to always try to improve people's vision and help you keep the vision that you have. And alternating current stimulation is absolutely an effective part of your eye vision care program, something you can do at home. In the clinical studies that we did with these, we had patients, two groups. We had patients who've never had treatment before and a patient who's had some form of treatment, either acupuncture, hyperbaric, microcurrent stimulation, or something. So 90% of the patients showed objective measurable improvements. And what that looked like is patients came to our clinic and they did vision testing. Then we sent them home with the ACS 3000, and then they came back for vision testing. We actually measured their improvement in addition to asking them if they had noticed some subjective improvements as well. So 70 to 80% of our patients saw subjective improvements or had indicated that, and 90% showed measurable improvements. Those measurable improvements include visual acuity, visual fields, OCT test, color vision, contrast, so on and so forth. So that it was fantastic. It was actually, I did not expect to see that level of improvement, so I was very excited. So this again can be a standalone therapy, but if you're using it as a standalone therapy, I still encourage you to implement lifestyle factors like cleaning up your diet a little bit, maybe getting food allergy testing, getting trans fats out of your diet, watching things like alcohol, stimulants, nicotine, the energy drinks, things like these that are going to be very pro-inflammatory and dehydrating and overstimulating to the body. So we want to use that. Also things like supplements, specific supplements like we recommend at Eye Health Institute, or maybe you're taking some your own. So we do recommend that. And we also recommend that those who want to use it as part of an integrative modality for if they're doing other therapies, for example, acupuncture, vision therapy, lymphatic drainage, hyperbaric, laser therapy, so on and so forth. Any of these other modalities that can be really, really successful, again, for helping people who are trying to recover vision and preserve their vision long term. So the best clinical outcomes for sure, even if you are getting some treatment. Again, there's really no treatment right now for these conditions, including Stargardt's RP, rod cone dystrophy, and cone rod dystrophy. But even when there is, we're definitely going to recommend that people still continue to use this for their overall eye health until there's some, radical, groundbreaking improvement or discoveries that they find with this. So we do recommend supplements. We do recommend things like ophthalmic acupuncture. We do recommend Chinese herbs for a lot of cases, daily meditation, eye qigong, physical exercise, stress management, keep your body hydrated. Sleep habits are really important. So all these factors, again, there's a lot you can do, and it's been said that for a lot of these conditions, there's not too much that's available. Or you go to your eye doctor, your retinal specialist, and you're told there's nothing that can be done to help you. Or maybe take these AREDS or vitamin A or omega-3 DHAs or lutein zeaxanthin. And we know that's simply not true. So there is a lot available to you. Alternating current stimulation is a viable treatment option, especially when you add them to and combine them with some other treatment modalities. But even if you're just going to use alternating current stimulation at home, the ACS 3000, and you definitely want to take some supplements, do things like the eye exercises, and maybe even consider a telehealth consultation if you want more specific guidance and you can't physically get to our office. we can do a 30 or 60-minute telehealth consultation to go over your case specifically and what we might have available for you in terms of if or how we might be able to help you with your case in terms of recovering vision. In most cases, we can. And then again, the bigger long game is more for long-term preservation. So that's my wrap on alternating current stimulation for retinitis pigmentosa, rod cone dystrophy, and Usher syndrome. If you have any questions, please feel free to reach out about your specific case. If it's for you, if it's for a family member, a friend or a loved one, or somebody you just maybe know, a friend or a colleague or something like that, please, please, please share this information with them. Most people, again, are told there's nothing available to them. And having done this for 25 years and treating over 10,000 patients from over 50 different countries, I can say with absolute certainty there's a lot that can be done. So we always recommend and appreciate those who are sharing our content with other people who they think might be interested and find use value in what we offer. So thank you for joining us. Take care. We'll see you soon. Have a great rest of your day. Bye-bye.